Hello, I'm Dr. Mike Milligan. I'm here with Demas from Technology for Medicine out of San Clemente, California. Demas, thanks for joining us.
Thank you for having me. I appreciate it.
Great. Well, Demas, he's got a soft tissue Perio laser. And Demas, why don't you tell us about this?
Well, it's an exciting new product from Technology for Medicine. It's a InGasp 1064 Diode Laser.
Okay.
It's a next progressive jump in laser technology in that we've replaced the need for crystals and older crystal technologies such as that found in Nd:YAG.
Okay.
And have it in the form of a semiconductor and a small little package here.
And a little chip, right?
And a little microchip, yeah.
So that's why it can be so much smaller.
You're absolutely
and
right.
Portable and move it from room to room.
Bingo.
Okay? So it's a lot easier to handle.
Absolutely.
Okay.
You're not carting it around the room.
Right, so it's very functional. So tell me a little bit more about this. What's the wavelength and all that?
It's a 1064 wavelength, and 1064 has a rich history in dentistry, specifically in the treatment of periodontal disease. And
it's specific to the perio tissues, right?
Right. It's been shown to have a much better bactericidal effect.
Okay.
And for soft tissue, it has a nice absorption level of hemoglobin in water, thus giving it a high bacteria kill rate. And the wavelength has been researched in dentistry for quite a long time.
Right. There's a lot of history on that.
Absolutely.
Studies and all.
Absolutely. And the wavelength was previously, again, limited to a larger machine.
Right.
And the only way we could make that wavelength in the past was by using big crystals and water-cooled systems.
Okay.
And our goal was to take that technology of the wavelength and package it into something portable and small that's easy to use.
Right.
And also try to cut the cost a little bit on.
Well, that's always good.
on it.
We appreciate that.
Absolutely. So give the doctors the ability to have the wavelength that's so well researched and desired for a little bit less of a cost and much easily managed.
Why don't you tell me about that? What's the cost?
The cost of the unit retails for $19,900.
Okay, $19,900.
$19,900.
$19. Okay, $19,900.
$19,900.
So that is very affordable then.
Absolutely. Frequently, you'll find the wavelength in the form of an Nd:YAG at sometimes
much higher.
3 and 4 times the cost. Yeah. Okay. So we were able to take that down drastically, and we're excited to be able to do so.
Okay, so and we're not talking any hard tissue with this?
This does not do hard tissue. It's a phenomenal soft tissue cutting laser.
And what all procedures can you do with this laser?
Oh, you have the treatment of defocus light to treat things like aphthous ulcers, herpetic lesions, desensitizing teeth and all the such, preconditioning tissue to create photobiomodulation.
What was that now?
The stimulation of the mitochondria via photons in the cells to increase blood circulation and decrease post-op pain.
Okay.
Increase the healing times for your patients, which is always nice. And from the soft tissue procedure, everything that you love to do now, gingivectomies, frenectomies, crown preparations. The CEREC and
the troughing around the tissue of the crown preparation.
In order to take your impression, right.
Got it. Okay.
You're troughing, I should say. Yeah, you're absolutely right.
Got it. Okay.
So laser troughing works phenomenally well with this, and we've been able to utilize the system to cut down the amount of thermal necrosis typically found in most lasers, while increasing the speed at which it cuts.
Okay.
We've really rid the diodes, anyways, of really going quite slow and maybe dragging a bit and creating a little more burning than that. We've really resolved that issue by offering a 1064 wavelength, which seems to have corrected all those problems, and it moves beautifully through tissue, and doctors are quite happy with it.
Great, great. How about a little history of the company? And I know it's Jeff Jones and the credibility there.
Our executive.
Why don't you kind of walk us through that?
Yeah, absolutely. Technology for Medicine was founded about 2.5 years ago now.
Okay.
And
great growth.
Great growth since then. We're very happy with that. And it was founded by the senior executives of BioLaser, Jeff Jones and Keith Bateman.
Okay.
And we have definitely a very rich history in lasers and progressing laser technology over the past 15 years now.
Right.
So we're very well versed in lasers. New company, but old minds.
Well, right, the brilliant minds that have been around in laser and brought innovation to lasers in dentistry, and now they're on to their next generation product here.
You're looking at it. They were very instrumental in bringing forth hard tissue lasers to dentistry and soft tissue lasers alike. Mm-hmm. And now this represents the next progression in lasers for dentistry, and we're excited to be the ones to bring it to everybody.
Great, thanks. One last question here, if you wouldn't mind.
Absolutely.
For those who aren't as understanding of lasers, there are some very inexpensive lasers out there in the single $1,000 range. Mm-hmm. $5,000, $7,000, $8,000 range. How is this different from those? It's a whole different range of procedures you can do there. Right. This one is one of the big dogs for periotherapy.
Absolutely.
So tell me about that difference.
That's a good question. The other lasers on the market in the form of diodes and semiconductors are different wavelengths. Right. And wavelengths do play a large role in tissue interaction. The less expensive ones that you were mentioning typically are in the 810 nanometer wavelength. Okay. Which means they have different absorption levels of different elements like water and hemoglobin. Thus, they react to tissue differently. Okay. So commonly we'll have doctors, for simple soft tissue procedures, find that their 810 lasers maybe go a bit slower than desired, create quite a bit more thermal necrosis and drag. In fact, we call the technique the scratch, drag, and dig technique is the way of using them. And we did offer 810s. And
drag and dig. Okay, well, we don't want to do that.
No. So we've, again, overcome that problem by offering this wavelength, which seems to have eliminated all of that. Okay. And in conjunction with that, we offered the wavelength that's optimal for perio. Right. So we're kind of brought the two worlds together. You're getting a laser now that can do more, and you're getting more value out of it, and thus more production in the practice as well.
Great. This doesn't do any bone, right?
This will not cut hard tissue. No, this will not do bone.
No bone, no teeth, but all the soft tissue procedures.
No osseous and no dentin, but they will actually do.
How do we get in touch? How do we learn more about this laser and your company?
We go to our website. Would be the easiest and fastest thing. As soon as you, right now, actually, probably just open up a new page and go to www.t4med.com. T for med.com.
The letter T.
The letter T.
The number 4.
med.com.
Okay, great.
It's that simple. You'll find information on the 1064 as well as a few other lasers that we have for low-level laser therapy as well. Okay. For wound healing and pain management as well. And our contact information, phone number, fax number, and email address is on there.
Everything on there.
You can also click open your little Outlook and send me an email at dgarcia@t4med.com.
Great. Thank you so much.
Absolutely. Thank you for having me. I appreciate it.
All righty.